Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example, it's an 11-month-old German Shepherd dog with right pelvic limb lameness that started about 10 days ago. Beginning with the lateral view, I like to look at both the bones, the articular surfaces, and the soft tissues when I'm assessing musculoskeletal radiographs. To look at the findings, I will bring your attention to the medullary cavity of the femur. Especially in the proximal diaphysis, you'll note that there's increased opacity and there's soft tissue opacity where normally we would experience more of a fat opacity. There's also loss of the normal trabecular markings. If you look at the distal femur, you can see that the normal trabecular pattern is an interdigitation of mineral density, mineral opacity, as well as sort of a fat opacity. If we look at the more affected part of the femur, you can see that the opacity is quite uniform. I also like to look at the periosteal and endosteal surfaces, meaning the outer and inner aspects of the cortex, and you can see in this particular case that they're smooth. Let's go to the other view. Here we can see that when we have both femurs in the view, that not only is the right femur affected by this process, but there's also increased opacity in the mid-diaphysis of the left femur. Before I conclude about these findings, I'll make a few brief comments about the pelvis. There is some obliquity of positioning in the pelvis, which does somewhat limit our interpretation of hips. Of course, the young patient age can also limit the use of this view. We know that this view is more reliable for assessing hip status in patients that are 2 years of age. When I look at the obturator foramen, I can see that the right one is larger than the left, and that tells me that the pelvis is obliqued. The positioning of the femurs is very good in this case. You can see that they're parallel to each other, and that when we look distally, that the patella are relatively centered, although more so on the right than the left. So overall, given some minor limitations of assessment, I would say that the hip appearance is adequate, especially given the breed. Now, let's get back to discussing the status of the medullary cavity. When we have multifocal, which I like to use the term polyostotic, medullary opacities affecting multiple bones, the most likely differential given the patient's signalment and history is panosteitis. Increased opacity in these cases, we think, relates to reduced medullary fat being replaced by inflammatory cells and edema, which has more of a soft tissue opacity. Be sure to review the full report associated with this case, and thanks for listening. Remember, it's your case, so post your questions on social media. We encourage case discussion, and we're more than happy to help.